Usually, when you talk to a founder in health tech, they're quick to drop in the necessary buzzwords. It's usually generative AI, machine learning, VR, AR, APIs. You get the picture. But every now and then, a founder surprises me by going old school. In a recent interview, Paul Campbell, CEO and co founder of Moneta Health, referenced a technology that stopped me in my tracks: the humble landline. Welcome to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster. My children think of landlines as something from old movies, not as a relevant piece of technology. But Moneta Health has figured out a way to provide evidence-based care for people with early signs of dementia or Alzheimer's over the phone. That low-tech delivery model is key to their business since it reduces tech barriers and increases adoption. Just think about the difference in ease of use between remembering to update an app and use it regularly versus simply answering a phone call and beginning to talk. To be fair, as Paul explains in our interview, this platform works over any phone, smartphones included, and there's a robust AI component that makes the platform scalable. So this is truly old school meets new school. After we hear from Paul, in an interview I recorded on the street outside the Alzheimer's Association International Conference in Philly, we'll spend a few minutes with Bill Yanowski, CEO of Zinnia. Like Moneta, Zinnia is building a high-impact product on a somewhat humble technology, this time the television. As you'll hear, Bill and his co-founder Allison Schreier are designing smart video content that can be used to calm folks with more advanced dementia, decreasing the need for sedative narcotics and making life more peaceful for caregivers. First up, here's my conversation with Paul Campbell from Moneta.
Moneta is a brain health company, and our mission is to transform the standard of care for the treatment of cognitive impairment.
Okay. One thing I love about Moneta is your use of the telephone, a use of voice to voice, and the combination of human-to-human interaction plus AI. So kind of walk me through, let's say my mother is on the platform. What's the patient experience like?
Yeah, so what we've built is really sort of old school meets new school.
Okay, I like that.
The standard telephone as the primary user interface or user experience for the patient to engage both with the live therapy with the Moneta therapist and the on-demand therapy with the voice AI agent that we call Mona. But all of that complexity is hidden because we're dealing with today's population of older adult that is dealing with these challenges of cognitive impairment. The last thing we wanted to create was a barrier to access, to scale, and to equity. Now, about the experience, really, step one is an assessment that gets done between your mom and a Moneta therapist, delivered over the telephone. Takes about an hour. Then that informs the care plan, which is the series of on-demand activities that are delivered through 3 phone calls per week that take about 20 minutes. And then at the end of the month, sort of assess, see where the patient is on their journey, and then they either go into another month or they get discharged into our prevention program.
How much of the innovation around Moneta is the actual modules that you go through, and how much of it is the sort of tech stack that kind of knits it all together, the Mona plus the phone calls? Are you using new methods?
So we are using, from a clinical foundation, we're using an existing evidence-based protocol
Makes sense.
called cognitive rehabilitation therapy, sort of like physiotherapy for the brain.
Okay.
But what we've done is translate that into something that is highly accessible using the tech stack build of the old school and the new school.
So you don't have to confirm that this modality works. You're using cognitive rehabilitation therapy. Okay, so we know that works, but you're delivering it in a new way using AI. It's more accessible.
Exactly.
Okay. Talk to me about your go-to-market strategy involves working with Medicare. Tell me about how that came to be. That can be difficult for a startup to work out, and why that's important for you.
Yeah, so my co-founder and I, Jen Flexman, when we pivoted to cog rehab therapy, sort of both of us have been in the digital health space for a while. And one of the key things we identified was who is going to be the payer? Who's going to buy this? We know there's
First question.
We know there's patient demand, but there's been a lot of great innovative companies that have just failed to get liftoff because they hadn't figured out the business model.
Yeah.
So cognitive rehabilitation therapy, there are existing codes
Okay.
that we are able to build. And so when we built our initial product, we wanted to test and prove that we could qualify for Medicare reimbursement.
Yeah.
So once we checked that box, then we took a state-by-state approach to
Smart.
distribution, working primarily in neurology deserts. So these are the places where there's high patient demand, but limited both primary care and neurology capacity.
Yeah.
So that's why we're operating in states currently of Nevada, West Virginia, Montana. So those states
Yeah.
where there's a great need, older population, but just not enough capacity, and we fill that gap.
Sounds like you're being very strategic, which I'm taking is from your previous experience. You've been a CEO before.
Yes.
You've led tech companies, health companies. You guys, this is not your first rodeo. How are your older patients responding to the AI side of the business?
Yeah.
Mona.
Yeah. So what's most exciting to us about that is, there's a quote, and I'm going to mess it up, but basically, like, great technology is invisible, right, to the user. And our patients, while they know that they're engaging with Mona, this on-demand agent, it's really in the background. What they see is that their therapy assistant is available 24/7 on demand whenever they want.
Yeah.
And the real connection point is their relationship with their human therapist, who gets all of the feedback from the on-demand therapy engagements, and it ties it all together. So they just think of Mona as sort of part of a whole solution,
Yeah.
but they've got somebody that's always accountable and supporting them through their cognitive journey.
Okay. How are the neurologists responding?
So that's been also really something that we've been very encouraged by. They identify a huge gap. Case in point, we're working with a health system out of Montana,
Yeah.
and they're responsible for about a quarter of the population, about 270,000
Wow.
patients. Their neurology department for the whole health system is a couple of people.
Wow.
Yeah. So when he learned about what we were doing and their team learned about what they were doing, like, this is filling this huge
Yeah.
gap, because we want to intervene early,
Yeah.
and we also want to be able to provide this longitudinal care so that when they do need those specialty services, they're there.
Like the therapies we're hearing about here, and
Exactly.
this group is very excited about. Remind our audience, like, how many people are bumping up against mild cognitive impairment? Like, how big is that population?
Unfortunately, it's huge and growing.
Yeah.
There's about 20 million older adults, 65 plus, who are experiencing the early stages, so mild cognitive impairment, or the early stages of a form of dementia, whether that be Alzheimer's, which this conference is about, or dementia triggered by a traumatic brain injury, post-acute stroke,
Yeah.
Parkinson's. So there are a lot of causes to this, and as our population ages,
Yeah.
we're just going to see those numbers grow, and we're not situated. This is the reason why we're so excited about all of the innovation that we're seeing here at this conference, addressing the whole continuum,
Yeah.
from diagnostics through to late stage care.
Traditionally, there hasn't been a ton of hope in Alzheimer's in terms of, like, well, what can we even do if we have the knowledge? How effective is cognitive rehab?
So the evidence is very strong and growing. There was a recent sort of like meta-analysis, the Cochrane Review, published in 2023, that sort of took the next step of looking at all of the implementations of cognitive rehabilitation therapy. Bottom line, recommendation that it should be standard of care, and that it is effective, and in many regards it's as effective as many of these disease-modifying drugs in terms of promoting quality of life and independence and prolonging the decline.
Yeah. How much of the rehab has to do with social issues, loneliness, social connectivity?
Yeah, so there's really sort of three legs of the stool in cog rehab. The first leg is the cognitive training component. So really understanding where the deficits are for the patient is that short-term memory, procedural memory, executive function, and that there are exercises, really based on neuroplasticity that can help address those needs. The second leg of the stool are those lifestyle components.
Yeah.
There are risk factors that really impact one's cognitive journey, sleep, exercise, nutrition, social connection, stress management. And so we have exercises that address those. The third leg of the stool, which is really kind of how the patient takes this into their daily life,
Yeah.
are compensatory strategies. Think my glasses are a compensatory strategy
Okay.
for my declining eyesight, right? So compensatory strategies can be internal or external, verbal rehearsing, creating lists, putting them in the home. And so we help both the patient and the caregiver across those three legs of the stool, and that's what makes up Cog Rehab. And I think like sort of the killer app around the Cog Rehab is that it's all focused on functional goals
Yeah.
and outcomes.
Yeah.
I want to make a cup of coffee in the morning.
Increasing quality of life for that
Exactly.
individual.
Yeah.
I love it. Paul, well, thank you for taking a minute with me. I love that you are not only bringing some relief to these patients, but also these neurologists who are, burning out from having to deal with this growing population, don't have the tools they need. Smart business model, working with Medicare, with existing codes. So excited for what you're going to do next.
Thank you, and we're really, really excited to be part of the Startup Health Alzheimer's Moonshot. It's a great community that is collaborating, and it really is going to take a team to
Yeah.
drive the impact that we want to see. So thank you,
Awesome. Well,
Logan.
good to see you, Paul.
Cheers.
Next up, here's Bill Yanowski from Zinnia. He's brought together leading designers from Silicon Valley with dementia caregivers in order to craft therapeutic television that truly makes life better for patients and their loved ones. Here's Bill.
It's been really great to get to know Zinnia. You joined the Alzheimer's Moonshot at Startup Health a few months ago, right? And to learn about you and Allison and the team, it's been fascinating. As a way to get into the company and understanding it, you have an impressive media CV, and I'm kind of curious how you were brought out of those roles, and what was it about the idea of Zinnia that caught your imagination, got you excited, and made you willing to jump into a healthcare startup, which is a tough task?
Absolutely. So it all comes down to individual relationships and stories. If you talk to anyone who's in aging services or Alzheimer's or dementia, it often comes down to the story of a person. And it could be a person as a caregiver you took care of. It could be someone that you know. And for me, that story was Allison. So she was a caregiver to her husband who had early onset frontotemporal dementia. And she was using a solution to try and, a media solution using video to try and find ways to engage him, to calm him, and to help him manage day-to-day activities. And when I was connected to her through another colleague of mine, it was just a mission that I wanted to be part of. And there's so much satisfaction and difficulty that comes with working at an early stage startup in the healthcare space. But the impact is really amazing, and it spurs us to keep going.
So the product itself, therapeutic television, you might say, right?
Yeah.
It kind of looks like slow TV, but with all of this thoughtfulness behind it, this really careful. So talk to me about what the programming looks like.
Sure. So the programming is research backed, and we've tested and iterated over time to really hone it. It's something that where we take, it's slow moving, it's gently paced, it's free of plot and dialogue, and it takes everything about regular TV and regular media that people living with dementia often find themselves consuming, but having difficulty in triggering because of a commercial or an inappropriate topic, or it's too fast paced to track. And that leads to negative behaviors and agitation and an increased caregiving burden.
Yeah.
So we strip that all away, and we build all of the content from the ground up with the viewer with cognitive impairment in mind.
Okay. Talk to me more about the caregiver side. Yesterday, while I was coming to this conference, I posted on social media to my followers, hey, what would you like to know about Alzheimer's when I'm interviewing these folks? And one thing that came to the surface was, how can we get more resources into the hands of caregivers? And so I thought of Zinnia. How does your product change the life of a caregiver? Like, how is it different for them to have this tool?
Sure. It works in two ways. One, it's a tool that empowers them to use as part of caregiving. So if someone is agitated, you can show them a topic that they love and redirect them to something else. If someone is resistant to drinking water or going to bed or taking a shower, we've got videos that model or cue that behavior that puts people in a more receptive mindset to do that thing. And then also, it's always sometimes hard for caregivers to connect with the person, to find meaningful engagement, moments of joy, and Zinnia helps them do that.
Huh.
Now, that's the tool basis of it, but from a caregiver as well, when they use that tool, it helps them to reduce their own stress,
Okay.
which is incredibly significant because caregiving is hard.
Yeah.
It offers them opportunities for respite. So if you can put on a video that's engaging enough for 10, 15 minutes, you can do something around the house that you've been putting off that you need to
Yeah.
do, or you can just get a little time to yourself. So, and then we've also told that caregivers, when it's on in the background for the person that they're supporting, it calms them. They find it enjoyable. We hear from caregivers who say, I bought it for my husband, but I watch it all the time too.
Calming them down. How difficult is it to measure effectiveness? Does it actually calm people down? Does it actually help them to do those daily tasks? How do you measure that?
So we've done research. We've done 2 years of research with the University of British Columbia and Vancouver General Hospital.
Okay.
And they've tested Zinnia both in long-term care, homes, and hospital settings.
Okay.
And so they've observed that Zinnia does reduce agitation. It does help with ADLs, especially when used as part of a routine, because routine is so important with dementia.
Okay.
And it helps people to engage and connect. So most of that is qualitative. But we are doing some work to try to quantify reduction in agitation. We're
Okay.
doing some work with Duke University, measuring cortisol, the stress hormone in saliva for caregivers and people living with dementia. So that's another way where we can quantify it.
You said caregivers and people with dementia, so the stress levels of the caregiver just as important in that scenario.
Absolutely, they're a team, and if the person with dementia is happy, the caregiver is happy.
Yeah.
So this tool serves both of them.
So if you're able to prove that you can bring down agitation, my guess is that you can reduce the reliance on drugs.
Absolutely.
What's that equation like?
Sure. So Zinnia is a non-pharmacological intervention. We have testimonials of people who were regularly on antipsychotic medication, who a caregiver knew that a particular video about their background that connected with them as a person could potentially connect with them and redirect them. And they were able to successfully do that. In this case, it was the baby's video,
Okay.
because this person was a pediatric nurse for most of her
wow.
career.
Wow.
And they changed her care plan and took her off that antipsychotic. So that's another area that we'd like to do some work on, kind of find a pilot partner in long-term care, figure out how often they dispense antipsychotics across the community, use Zinnia for a couple of months, and
Yeah.
then check what that result is later. And we expect to find a decline.
Yeah, I just want to zero in on that story for a second because it's easy to miss the intensity of that interaction. You're talking about somebody who previously a pediatric nurse, physician. They're getting to the point of agitation that they have to be basically tranquilized. This is a traumatic event for them and the caregiver to have to be given an antipsychotic drug. And yet, by watching something that brings them joy, that actually can take away that need. I mean, it's really a dramatic scenario.
Yeah, and the funny thing about it is what we're doing seems simple from the outside,
Yeah.
right? It's television, a little bit slower. It's something that people normally do and watch, but we can use it in intentional ways to create real meaningful impact.
Give me a couple examples. I know there's some ways that you're super thoughtful about the videos that you might not notice if you just sit down and start watching it. Colors, timing, tell me a little bit about that.
Yep, sure. So all the videos are very visually vivid, and we use music and sound effects in the background to get people's attention. It's a really great multi-sensory experience. If you're watching a video, yes, you'll find that it's a little bit slower. We'll stay on the frame of what we're looking at for longer than maybe you or I might want to watch that. But for someone whose brain is processing things more slowly, it allows them the time to recognize what they're watching and enjoy it. We will generally don't have plot or dialogue, but there is a narrative arc. So there might be a day, the breakfast video, for instance. It's not just people sitting at a table eating breakfast. It's eggs and chickens and milk and cows and all of the breakfast kind of coming together in a narrative way. And it really helps to ease transitions and get people more in the mood to partake in that meal.
Yeah. What kind of response are you getting from a community like AAIC, which is dominated by scientists and sort of hardcore research? How do they see and how do you see Zinnia fitting into that larger ecosystem?
Sure. Care. So if everybody succeeds here,
Yeah.
Zinnia won't be necessary.
Yeah.
And that's not a bad outcome for the world, right? But until they do, and all the therapeutics and the diagnostics are more early stage, but
Yeah.
once you get to mid to late stage, there's less that, can happen for someone living with dementia. So,
Are you seeing that there's not a lot here for late stage care?
well, I just think that a lot of the research right now is focused on,
Yeah.
the new drugs are effective mostly at the early stage.
Yeah.
And so it's about diagnosing people early, getting the biomarkers and developing more. So all of that is excellent, but there's a real understanding that there's a whole group of people who will need to be cared for, and that's growing, and how will we do that?
Yeah, it's no knock against what's happening here, but I do see a gap in innovation in the caregiver space. I mean, do you see that there's more opportunity in that area?
I think there's some new things that are coming out that the CMS guide model is a whole model to change how care is delivered and reimbursed, and it's a kind of a holistic kind of thing with care navigation and caregiver support and training. So it brings the caregivers and the person living with dementia together as part of this. It's brand new. It's going to go for 8 years. And I think that's a large place where there's innovation in caregiving. And that's a place where we can help as well. We're working with a guide model awardee on the West Coast University medical program for Alzheimer's and dementia. And they're providing hundreds of Zinnia subscriptions to the caregivers and people that they support. So we're excited about that, and we want to see that expand.
That's awesome. It makes a lot of sense. So what's next? So over the next 12 months, what should we be looking forward to?
We're going to continue to test and iterate on content with new formats. We are going to bring in more personalization. We are going to, meaning the ability to create content faster for you. You can say, hey, I'm interested in motorcycles or something like that. And we're going to be able to use some of the new AI tools that are out there to create our Zinnia style of content kind of at scale for Logan. Because personalization is so important.
Yeah. In the same way that we're getting used to sort of recommended songs or recommended videos,
Yeah, exactly. We're going to do work on outcomes testing. So we're going to try to put some metrics to the things that we're seeing. And then we're going to use that to market beyond the individual family caregiver to organizations that support groups of caregivers, like that guide model participant on the West Coast that we're working with, like the state of New York, who we're working with to provide Zinnia to caregivers in New York State.
I love it.
And others like that.
Bill, thanks for giving me the update. I love how elegantly simple it appears on the front end, how thoughtful it is on the back end, how much good it can do for patients and for their families. You're doing a lot of good, and I wish you the best.
Thank you, and thanks to everything that Startup Health is doing for the ecosystem, the Alzheimer's Moonshot. We had that reception yesterday. I got to meet all the other companies and founders, and it's really a great community, and we're already working on ideas how to work together and collaborate.
Well, okay, before we run, any examples? Like, how have you experienced that community in action?
So it's, through the various sessions, you get to know people, and then everybody has these offshoot conversations. And so we've worked with one company that's put us in touch with who they're using from a digital marketing perspective. So on the business side, how do we advance things? And then we're actually going to integrate potentially our product with another product that's working on, as an enhancement or a complement to what they're doing.
I love it.
So yeah, lots of stuff in the works.
Bill, I wish you the best, and have a great conference.
Thank you very much. Likewise.
Thanks for listening to Startup Health Now. We'll be back again with another episode next week.